Hey there, welcome to Ask Dr. Patel, where I answer your questions about medical marijuana. I'm Dr. Patel. I specialize in the area of medical marijuana, which means that I step-by-step walk patients through how to use marijuana for their specific medical conditions. So let's get on with today's question. It comes from Robert of Mill Valley, California, and here's what he writes. Dr. Patel, I've had high blood pressure for several years now. It was discovered on several visits to my doctor, and in each visit, my blood pressure was high. My doctor and I decided that we'd work on implementing some lifestyle changes to start off with because I wasn't too keen on taking prescription medications. For a good year, I tried things like lowering my salt intake and avoiding alcohol. I also went for 30-minute walks about 3 times a week, and on the other days of the week, I would do some yoga and meditation. But my blood pressure remained the same after a year. So I had no choice but to start taking prescription medications. It took a bit to settle on the right combination of medications because some of these medications gave me side effects like a persistent cough, frequent urination, and dizziness. Although even with my current regimen of medication, I still continue to get leg cramps and feel fatigued. My preference is to not take any pharmaceutical drugs whatsoever. So I started doing some research on Google and came across some articles that say that medical marijuana helps to lower blood pressure. Before I go out and get my medical marijuana card, I wanted to get some more information from you on using medical marijuana for high blood pressure. Regards, Robert. So Robert, I'm really glad you wrote in, and it's good to know that you're making a tremendous effort to manage your high blood pressure. And I'm sure your doctor told you that high blood pressure, which is also known as hypertension, is a medical condition that you want to take very seriously. And this is because generally it shows no symptoms. So critical situations like a heart attack or a stroke can seem to rise out of the blue, but really they're a result of the damage that the high blood pressure has done over a long period of time. And there's a reason why it's called the silent killer. Now, when it comes to medical marijuana and high blood pressure, I've come across some very fascinating research. So in research done on rats, marijuana only had an effect on blood pressure in rats that already had high blood pressure, but it had no effect on rats that had normal blood pressure. So there's a reason for this phenomena. And that's because the rats with the high blood pressure expressed more CB1 receptors in their heart and their blood vessels than the rats with the normal blood pressure. So CB1 receptors are basically these itty-bitty little structures on cells that act as an in-between, allowing the cell to interact with the marijuana. Now, when a cell expresses more CB1 receptors, it's now even more sensitive to the effects of the marijuana. In this case, the rats that had high blood pressure produced more CB1 receptors, and so their heart and blood vessels were more sensitive to the effects of marijuana compared to the rats with normal blood pressure. Now, once marijuana starts to interact with these receptors, the effect that it has is that it lowers blood pressure in 2 ways. The first is that it decreases the force with which the heart pumps. So I would liken this to lowering the tap on a garden hose, which essentially lowers the water pressure. So in a similar way, lowering the force with which the heart contracts lowers the blood pressure. The second way that the marijuana lowers blood pressure is that it causes the blood vessels to relax. And I'd liken this to widening the diameter of a garden hose. Now, when you widen the diameter on a garden hose, it's obviously going to lower the water pressure. So in a very similar way, when you relax the blood vessels, it widens the diameter of the blood vessels, and it causes the blood pressure to go down. Now, when you searched on Google, you probably found a whole bunch of articles that said that medical marijuana helps to reduce blood pressure. But here's the thing, that research is done on rats, which doesn't necessarily translate to humans. And you'll find this surprising, but I found in my own patients with high blood pressure, the medical marijuana doesn't actually affect their blood pressure levels. I haven't seen any change in blood pressure in my patients, even after they've taken medical marijuana on a regular basis for about a span of a year. The patients that were on prescription medications had to continue to take these prescription medications to help manage their blood pressure levels. Now, while I didn't see an improvement in their blood pressure levels, I also didn't see their blood pressure levels get any worse. So in general, it seems like medical marijuana doesn't impact blood pressure levels in humans, even though the research seems to say otherwise. At the end of the day, I'm careful in recommending medical marijuana to patients with certain conditions, like those who've had heart attacks or strokes, those who have known heart or coronary artery disease, and patients with kidney damage. So, Robert, I hope this helps. I'm glad you asked me the question because it comes up very frequently during my patient visits. And as always, if you have a question for me, go ahead and post it in the comment section below, and I will try my very best to answer it in a future video blog. Thank you.